Welcome to 450 Broadway. My name's Todd. Let me give you a little tour of the Outpatient Surgery Center. This here's the pavilion. As you can see, the decor is very peaceful and nice for the patients when they're coming in here for surgery at the OSC. We got guest services here. We got Hector behind the desk. All right, let me take you upstairs. This is the OSC. We're at the reception area. This is where all the patients come in to get checked in for their procedure. Some of ours have a dry erase board, grease board. Some maybe have 1, 2 TV screens here at OSC at Stanford. You can see we have 6 going right now. You can see up on the board here we have some yellow. Those are patients that are still in pre-op. The green are the patients going from pre-op into the operating room and in the operating room. And then once they're done in the operating room, they turn to blue when they go out into recovery room. So you've seen our screens here in the operating room. Now let me take you to pre-op where all the patients are. We're here in pre-op. We got about 15, 20 nurses here, and speaking of pre-op nurses, we have Denise.
Hi, Todd.
How you doing?
Doing well. How about you?
Good. Do you mind giving us a little tour of pre-op?
Sure. Here at the Outpatient Surgery Center, we see a range of different patients, from patients with orthopedic problems, we see endoscopy patients, and patients with pain management problems. Here we are in our pre-op area. We bring our patients back here, admit them, make sure they're as comfortable as possible, and from here we go straight back to the operating room.
My name is Stephen Reggio. I'm a OR nurse here at the Outpatient Surgery Center in Redwood City. Our mainstay is orthopedics. We do podiatry. We do some chronic pain, spinal intervention procedures. Our patient population is a little bit lower acuity, so there's not the high level of stress that you would normally have at, say, like you would over at Palo Alto.
This is probably one of the bigger operating rooms you'll see, even compared to the main hospital. We have all top-of-the-line gear and equipment to make this the best quality care that we can give to our patients.
My name is Ricardo. I'm an anesthesia tech. I'm here to take care of business.
Right after they come out of the operating room, they come back into here into recovery, and this is where the patients recover until they're ready to go home.
My name is Ken, and right now you're here at the recovery room, post-anesthesia care unit. I'm a recovery room nurse. I basically make sure that the patients wake up smoothly, without any problems, without any complications from surgery, and make sure that they are comfortable.
So after the procedure, all the dirty instruments go down to SPD. They get cleaned and sterilized. They get brought back up here and put into the core. And as you can see, all the sterile instruments back here in blue are ready to be picked for the next case on the case carts that we have here.
I work with a very dynamic staff, of very cooperative and very fun-loving people.
Everybody we work with is really a great group. We all get along pretty darn well. The doctors are wonderful to work with. They're just very, very kind souls.
Thank you for coming on tour with me today. It's been a real pleasure. As you can see, we take pride in what we do here. We love our jobs. We're coworkers, we're friends, we're family. But I gotta get back to work. Take care.